Hello and welcome to Well-Minded Counseling. I am Stephanie Contra-O'Hara, licensed professional counselor. I'm going to give you a brief presentation today on how depression, anxiety, and eating disorders are intertwined, and hopefully give you some tips on how to help your teen as they experience one or all three of these concerns. So we oftentimes ask ourselves, how did our teen or how did our child get into the situation, have these emotions, have these thoughts and behaviors? And it really sometimes feels like it comes out of left field. So I would say an eating disorder oftentimes develops from anxiety, depression, some pre-existing mental health concerns. So it's best to know that it's not your fault as the parent. It's not anyone's specific fault. This is perhaps just a adverse way or unhelpful way to respond to these depression and anxiety symptoms and experiences. And then unfortunately, eating disorders take on a life of their own. So people with eating disorders are twice as likely to experience anxiety and depression when compared to people in the wider community. Therefore, they also often occur alongside one another. They say that people with eating disorders oftentimes experience anxiety even as a young child. I think the statistic is somewhere close to 80% of those that have eating disorders experience anxiety as a child. Okay, so these diagnoses are intertwined. As you can see, depression, anxiety, and eating disorders all have their own symptoms, and then I have put their crossover of symptoms in the other circles or the intersection of the circles. So let's start from the top. Depression. Oftentimes you can recognize depression in your child or even in yourself as feelings of helplessness and hopelessness. They no longer enjoy things that they used to enjoy, and sadness that isn't necessarily linked to an event. So when I say that, I mean like they're not sad over an argument that they had with a friend, or they're not sad over being grounded. They're just generally sad with no actual link or reason to be sad. And oftentimes, teenagers or children will try to find a reason to be sad or have some sort of like explanation for why they're sad because they don't even necessarily know why. And that oftentimes can be linked to just a pure biochemical response that their brain is having to stimuli around them. Okay, so depression also shows up in these other symptoms as having trouble sleeping. They oftentimes may think about self-harm or wanting to hurt themselves or end their lives, which also is heavily linked with anxiety. So anxiety has muscle tension, shortness of breath, sometimes obsessive thoughts, excessive worry, fear and racing thoughts. If it gets bad enough, someone may experience a panic attack. Anxiety oftentimes, again, can be linked to not necessarily one specific event. They just have anxiety about a plethora of things. That's how you know it's a difference between like anxiety or just being worried or stressed. Okay. Something that anxiety and eating disorders share is trouble sleeping, difficulty concentrating, and some perfectionism. Eating disorders have skipping meals, excessive exercise, binging, purging, labeling food as good or bad, hair loss. Oftentimes there might be loss of menstruation or experience other obsessive thoughts about food or their body, have an inaccurate idea of what their body looks like, or have an inaccurate idea of how much food they actually consumed. Okay, so something that depression and eating disorders share is decreased energy, fatigue, strong feelings of shame, guilt, weight gain or weight loss. Oftentimes, the person who has an eating disorder may have both depression and anxiety. So they may be experiencing all of these symptoms. And they all, of course, overlap with the low self-esteem, difficulty making decisions, and having difficulty relating to others. So obviously that's a lot of symptoms that someone might experience if they are having an eating disorder or experience an eating disorder. So it's definitely good to have a team of people to help you navigate this situation. I don't think that anyone or any parent should have to face an eating disorder alone. It's always good to get a team of a psychiatrist, your doctor, a dietitian, a therapist, perhaps a family therapist. All of these people are crucial into helping your child or teen or even yourself overcome an eating disorder, because recovery is possible. Okay, so what are some causes, like some deep-rooted reasons on why this may have developed in your child or in your teen or in yourself? Okay, so it's something called the biosocial theory, which is the biological, psychological, social, and interpersonal connection, and how each of these parts play a role in someone developing any sort of mental health concern. But today we're addressing specifically depression, anxiety, and eating disorders, but this could be linked to any sort of mood disorder or struggle that a person is experiencing. Okay, so biological. As you can read here, scientists are still researching the possible biochemical or biological causes of an eating disorder. In some individuals, eating disorder, certain chemicals, in some individuals with eating disorder, certain chemicals in the brain that control hunger, appetite, digestion have been found to be unbalanced. The exact meaning or implications of this imbalance is still under investigation. So eating disorders oftentimes run in families. That's why we think there's a strong genetic component. And it could even cross sexes or genders. Oftentimes, eating disorders are seen as a female issue. However, there is increasing numbers and increasing men that are suffering, or even other genders like transgenders, and the plethora of different types of people can experience eating disorders. May even be more common in other populations than we currently realize. Okay, psychological. So low self-esteem, feelings of inadequacy, lack of control in life, depression, anger, stress, or loneliness can all contribute to the development of any of these mental health concerns. Oftentimes these can be reinforced by different stimuli in the environment, which is why it is linked to social. So cultural pressures that glorify thinness or muscularity and place value on obtaining the perfect body. Now I know this has really been explored in the media, the social impact of how messages from the TV or overall media are impacting the way that we see ourselves. I think it can even go beyond that, and like conversations that people have about trying to control weight loss or trying to control anything about their life, whether it's how successful they are, how clean their house is. All of these desires to have something be a very specific way can trigger a very narrow focus for someone to become obsessive about the way that they approach certain situations, or how they approach maintaining a certain weight or a certain aesthetic of their body. So there's narrow definitions of beauty that include only women and men of specific body weights and shapes. Cultural norms have people or value people based on their physical appearance. You know, we all say that, you know, everyone should be treated equal, but it is oftentimes the first impression of a person's size or weight determines a lot of things that come after that. There's also stress related to racial, ethnic, size, weight related, or other forms of discrimination or prejudice. You know, so if you see someone on the street, you know, you may tell yourself like, oh, I don't like think about judging other people and I, treat everyone fairly, but there are sometimes even really deeply ingrained thoughts about other people's bodies that we may not even be aware of, but especially important to notice how we're actually interacting with other people and we are saying around our children or even about ourselves and our own bodies. Okay, interpersonal. So oftentimes people that experience anxiety, depression, eating disorders really struggle to connect or relate to other people. They may experience difficulty expressing emotions and feelings or even identifying them. Even coming up with the word of I'm feeling frustrated, I'm feeling annoyed, may be beyond what some of these teens and children have been communicating or are aware of, like that is a form of communication, like I feel blank, rather than expressing their emotions through their behaviors, whether it's attempting to restrict their food, whether it's getting in an argument, whether it's refusing to do their homework. All of those behaviors are linked to direct ways that they feel. And since they don't know necessarily how to express how they feel, it comes out in their behaviors. So that's a really big part of therapy, is teaching kids and teens, and also yourself if you struggle with this, a way to communicate how you feel rather than have your feelings and thoughts come out in your behaviors, especially destructive ones. So oftentimes people that have anxiety, depression, or eating disorders have a history of being teased or ridiculed based on size or weight, and they may also have a history of physical or sexual abuse, but that's not necessarily the case in every person, but there has been a lot of research linking incidences of sexual and physical abuse and tying them to eating disorders. So now that you know all of that information, how can you help your teen? How can you help yourself to move forward in this process rather than get stuck in the weeds of the problem? Well, the first thing I want everyone to do is take a deep breath. We oftentimes are faced with challenges or moments in our life that we feel overwhelmed or suffocated by. And oftentimes we don't even know where to start. But the best place to start is honestly taking a deep breath so you can have a clear mind and really be able to see the whole picture rather than find yourself crippled or paralyzed by the nature of the problem. So take care of yourself as a parent and as a person. You cannot fully be present to help your child if you are not practicing self-care, nor if you are not giving yourself permission to feel or look at your own thoughts surrounding food, body, anxiety, fear, depression, and pain. So there's many ways to breathe. Breathing mindfully can be a crucial aspect of gaining clarity. So I like to give people a breathing technique right when they start therapy, just so they can really have a foundation of how can I breathe through this. So mindful breathing is something that you do with also the assistance of counting. So breathing in 1, breathe out 2, breathe in 3, breathe out 4. You do the counting in your head so you can actually focus on the breathing. You get to 10 and then you restart. And each time that you restart from 10 to 1, you take a pause and notice how different do I feel now at 10 compared to 1. And continue to do that until when you get to 10, you don't feel like you need to go back to 1 because you've calmed your parasympathetic nervous system. Okay, so the next step would be to assess. You want to ask yourself a few questions. What is your child telling you through their behaviors? What physical symptoms has your child been experiencing? What are you worried about for your child? Are you as a parent experiencing anything that could be indirectly affecting your children? So remember that, obviously your teen isn't necessarily going to have the same sort of language skills that you have and may not be able to explain what's really going on with them. And emotional and mental symptoms often show up somatically. So what that means is like in their body. So when your child is telling you, or your teen is telling you, like, I have a headache, I have a stomach ache, um, I'm feeling like shaky. All of those are symptoms of feelings that they're having that they don't necessarily know how to express. Now, sometimes it can actually be a medical concern. I don't want to discount that, but oftentimes, especially if you have a fairly healthy teenager, some of these symptoms, if they're occurring on a daily basis, may actually be signs of mental health concern. And remember that your children are sponges. You may not be verbally sharing your stress. However, your children can be quite perceptive and be able to pick up these sort of things that you're experiencing without necessarily even talking to them. So it's best to try to calm your nervous system just for yourself as well as for your children. Okay, the final step is to respond with acceptance, move away from blame. Oftentimes, parents and other adults are really keen on blaming themselves, especially if their child is hurting. So it's really best to try to move away from that and avoid feelings of anger and resentment that can really fester when you find yourself blaming yourself. Start the conversation. So sometimes you may be afraid to talk to your teen about what you're seeing. However, there is a certain level of trust that you and your teen or you and your child do have. So try to build on that trust and have conversations about what you're seeing or what you're concerned about in a loving and respectful manner. And hopefully your teen or child will respond to that and actually be happy that you're bringing it up rather than ignoring it. Oftentimes I see in sessions, teenagers have like a deep sigh of relief that, like, man, my parents are finally like talking to me about this, because I didn't feel like I could talk to them about this by myself. So start the conversation. You may find that your teenager or child is happy that you did. Reach out for support. So assemble a support team for yourself and your teen. It can be friends, it can be your family, a treatment team, like I mentioned before. Just know that you're not alone in this experience. Okay, so prevention is key. Some warning signs that you want to look out for, I've listed here. The ones that I think maybe are most important are noticing an inflexibility in thinking, because that can show up whether your teen is anxious, depressed, or having an eating disorder. You want to recognize whether they're isolating themselves, whether or not they're attempting to hide themselves or go to the bathroom frequently, or even making small comments about how they think that their clothes don't look a certain way or that they don't fit in with everybody at school. All of those things are very important to notice. So how to access help. You can look at the NEDA website, which it has plenty of resources. You can look into the Denver's Eating Disorder Foundation that has monthly meetings. You try to find a therapist that is knowledgeable about treating individuals for prevention or for recovery. You want to be aware that having an eating disorder is one of the mental disorders that often needs medical attention. So you're going to need to really attack this from all angles, from your PCP to a psychiatrist to a dietitian, perhaps even other practitioners like a gynecologist, or, just basically you want to make sure all of the medical team members that you encounter all know what's going on, because they all can treat it from a different approach, a different perspective. Finally, remember that oftentimes the harder that you may push the individual to eat a certain way, the harder they will push back. So getting yourself help as a caregiver is also really important. Okay, so that is the end of the slideshow. I hope that you all gained some knowledge from this. And if you have any questions or concerns, please feel free to reach out, as I hope to help as many people as I can find recovery. My name is Stephanie Contra O'Hara, licensed professional counselor, and I can be reached through our main website. is www.wellmindedcounseling.com. Thank you.